Well, I hope you've all taken a lot out of today. I know that I have. I think what Sir Harry said this morning, the passion that he had and the humility that he spoke with, and I know that most of the people in this room, if not all of the people in this room, have that drive, and it's that keeps us going to achieve what we do. I've got lots of people that I'd like to thank, as I say, Sir Harry and Ian Welsh for coming along today. We've got Chris over there who's going to do the evaluation, so when I finish talking, if we can just do a quick evaluation before everybody goes, so we don't need to fill in bits of paper and things. I've got Tosh who's done the video, and actually he's done some really good clips on our YouTube clips that has got on our new website. It's all right, I only came back from holiday on Wednesday, so I don't really know where I am. I've got South Ayrshire Council for the use of this lovely facility, and I know more than once I've heard Kenny say that the council here must have the best view that any other council has in Scotland, and I think you're probably right. I'd like to also thank South Ayrshire Council and NHS, Ayrshire and Harran, for the partnership working that we've had so far and that what we've done. I think the future looks very good for us, and I know that at the SSEC, I know that we are having a joint showcase there of the work that we're doing with the mirrored theme groups and South Ayrshire Council. And a couple of weeks ago, myself and Andrew Moore from NHS actually went and spoke at Voluntary Health Scotland's conference about our joint partnership working, and people just couldn't believe how well we got on. And actually, I think people actually thought Andrew and I were actually having an affair. But it was just, people just couldn't believe the relationship that we had. Not that there is any of that sort of relationship. I'd like to thank Shirley for facilitating. I'd like to especially thank all my staff who have worked so hard to put this together, and also to let you know that next year we have got a new revamped website. The date for next year's conference will be on there in January. We're going to run some SDS work in conjunction with the Alliance for the Third Sector. We're going to have a conference with church groups to see how they can become involved with the third sector, and lots of more things next year. And last of all, I want to thank you, and I hope you have actually all got something out of it this afternoon. But I don't want any gossiping about me and Andrew Moore. Anyhow, just before we finish, if Chris and his buttons could get going, and I'll hand it over to you, Shirley. But thank you very, very much.
Great. If we could beg your patience, this is true cutting-edge stuff. I've never experienced this before, and Chris and I are about to do this as a team, and that is, you need your keypads, please. Keypads, please. I feel somehow I should give prizes for this. So we're going to have a series of questions. There's going to be 8, and again, you press the keypad, yeah? And then we see on the spot. So there's no kind of slipping you a fiver to make you say it was lovely. How good is the venue? Excellent, 1, good, 2, okay, 3, below average, 4, 5, poor. Keypads, please. Okay, results, please. You liked it. Yes, I liked it as well. That's good. We like that. Yep, okay, please. So we carry on. How good was the program content, i.e., the information, how it was sent? Excellent, 1, good, 2, okay, 3, below average, 5, poor. Excellent and good. And I don't have to look for who scored the others, because nobody did. Good. Then, VASA, you may be very pleased with yourselves. Could I have the next one, please? How useful? Because there's one thing about the content being relevant, the other thing is, will it make any difference? Okay, very useful 1, useful 2, okay 3, 4th limited use, waste of my time. Score, please. I'm in danger of falling in love with you. Thank you for that. Okay, this is you. You about you. Did you sleep? How satisfied are you with your own participation? Very satisfied. 1, satisfied. 2, that means you were asleep. 3, 4, no, you've gone. And 5, you never came. Okay, go for it. Who are my hums? Perhaps I won't ask. It might have got tired because at times it was pretty intense. Now, learning here means, I think, Mandy, you mentioned light bulb moment. Yeah, light bulb moment. Okay. Have you learned anything today? Yes, lots. 1, 2, yes. 3, a little. 4, not a lot. 5, absolutely nothing. Scott. Ooh. Good. I'm very glad, and we need to take that on board and concern ourselves of the 11% who are very little. But it's important to know that. Next one, please. Do you know what you're going to do with what you've learnt? Yes, definitely. Yes. Not sure? No, definitely not. It may be too early to know what you're going to do, of course. Given you haven't had much time to think about it, I'm feeling pretty good about that. And the not sure is it may catch you when you go to bed tonight or when you're in the bath. Okay, what is your knowledge level of health and social care integration as a result of today? Has today made any difference? Go for it, Chris. So we're going to look at that shift, yes. I think the goods, I sense the goods of, yes, there's more goods and there's a few more okays as well. Okay, the final biggie. Will you come again? Will you come to the next VASA conference? Yes, definitely, because the lunch was brilliant. 2 is yes, 3 no, and definitely not ever again. I hate you. Score, please. Yes, they are. That's good. That's very good, because you are clearly, from my impressions, you're the right people, and the right people to come back. Thank you very much indeed. I wish you hope, and I wish you resilience, and lots of connectedness, because you have it already. Thank you, everybody.